Hello, doctor. This is Elena Musimenta. I'm going to take you through how to analyze and group data for colorectal cancer prediction that was collected, and this we got it from cargo source. From this, we looked at different segments that are trying to explore. We looked at the age and the lifestyle, the healthcare access, and then socio-economic factors, other factors that could bring it up. This is the data that has been generated or collected over time, as I said, for the 5 years, which we got it from the open sources. With this data, we're going to look more of the different regions, because the data covers the entire world, and we're looking at the different regions and how the data is being, how many patients are being affected in those regions. Well, cancer has many stages, and of this is a chronic cancer that affects colon. With this, we're looking at, allow me go through the Tableau with how we started. And with this, I started with adding the file, uploading the file to Tableau. As you can see, the file has 37 fields with 89,945 rows, which looks at the different segments or fields. For example, the patient ID, the age, the gender, and the different screenings, the diety, and so many things. However, we are looking for this particular segment. We're trying to analyze not everything, but we are spotting a few that will be of meaning to our research that maybe was being carried out, or the data that was being collected. We are trying to make some good meaning out of it. First, we are looking at the patient percentage demographic. How are these different patients spread throughout the world? And I came up with a pie chart, and this pie chart is helping in showcasing the different regions and also their scale. When you see a yellow, you know that is Africa, with this percentage of how these people are being distributed in terms of percentage. Of course, it can be changed to the numbers, but I looked at looking at the percentage to be the best way of explaining this kind of data. So first of all, we looked at I looked at getting the sum and also the regions. So the regions were put in color and then some in labels. Why in labels? Because we want to, the numbers are supposed to be on these. So when you add up all these, they get to 100. So that is why I looked at that. So we had this one to be in the colors to give a feel of different colors, not necessary to have a single color. However, these colors are edited. You're able to change the colors, the formats, and you give it a different feel of what you want, and also to change something here. So percentage, I came up and changed it from quick, and then I want to give it a percentage of these totals. So that is where I had to change this to percentages. And then when you go to KPIs, that is key performance indicators, we are looking at the total number of patients, where we did the count of the patient IDs. And that one is done from here. You can go to analysis, you go to calculate, or you can even go right here, right click, and you go to calculate. So you can also find it here, right here. So we did a count for the number of patient number, that is the total number, the survival rate, and then the diagnosis rate. So with that, many things are happening. When you go to how we get the, you can go to edit and you're able to see the different calculations that I have managed to do, where we start with the patient count, and that is it. You go to count and then you're able to select, and then you add this so it will count for you the different number. Then there is also the survival rate, and the survival rate, it was a bit of a process which looked at first getting using the if function, and then you see the calculated field divide by the number of the count. The calculated field here, we're looking at calculating the survival. When you use the if function, you get that, and then you say divide it by the number of patients. So after obtaining, for example, when you go to calculate field, and then you say the if function, if open the brackets, you put in the survival. If the survival rate, survival status is equal to survived, then let's call it 1, or else let it be 0. If they don't survive, then it gives it a 0. So after obtaining all that, we gave it a name, because you have to give a name of that calculation. I gave it survival rate. So I used survival rate divided by the total number that was calculated. So when you look at the edits and you go to survival rate 1, you see that calculation, the sum of the survival rate divided by the patient count. So that is what we use to get the percentage or the rate of survival, the digit or the survival rate. So this is it. And then the last one is the delayed diagnosis rate. Of course, here we also apply in an if function. With this, we're looking at the time to diagnose. All this is was captured or was collected in the Excel sheet, where we have the time to diagnose, and also we looked at, so we came up with if function of if the time for diagonal, if the time to diagnose is equal to delay, then we call that 1, else we call it 0. So if it's not delayed, we call it 0. If the time of diagnosis was delayed, we have to call it 1. So that is the if function. So after applying that, we had to come up with a calculation where I looked at when you go to, because already we have it in the system, that's why I don't want to redo it again. When you come to the DDR, so the DDR is this, what we are getting here. However, we have also the delayed diagnosis, that is the F function that we applied, and we gave it the delayed diagnosis rate. So this is the calculation that I did, where I say that the sum of the delayed diagnosis rate divided by the patient count. So with that, when you say after all this calculation, you say apply, and then you say okay. Because that is already done, so we have the rate, the delayed diagnosis rate as 0.397. So that is our key performance indicators that maybe people need to know. Yeah. So when you go to the patient demographic, here we use the bar graph, and use the bar graph whereby on this bar graph you're looking the Africa, Asia, and different things, and also how is it showcased using the bar graph. And with the look of this, you're able to see that North America is the highest, that has the highest cancer spread, or colorectal cancer spread, and then the lowest is Africa. I think this is really self-explanatory because I already explained it under the percentages. And then when you go to the cancer stage distribution, cancer is in 4 stages, the stage 1 up to the 4th stage. So we looked at, I looked at having the patient count and vis-a-vis the stage of diagnosis. And according to the patient count, you see that the highest is the 2nd stage and the lowest is the 4th stage. Basing on the data that was that I used, that is how you can able to tell that actually cancer spreads more, or it has more patients in stage 2 than any other stage, which makes a sense that most of the people, they actually don't reach stage 4. However, most of them also don't know that they have cancer at stage 1. So by the time people realize that they are sick, when they're already at stage 2. And I say that this analysis here makes quite a bit of sense if you see how it is. So here we look at the effectiveness, or the treatment effectiveness. So with this, we're looking at the different treatments, chemotherapies, radiotherapy, and surgeries of patients. If they receive the surgeries, how is it? And if they don't receive it, those that receive the chemo and those that don't receive, we are looking at them in terms of the having the patients, and also looking at their different like genders. So here in the treatment, so this first column looks at the treatment where there is a yes and a no. And when they say treatment and we say the majority is no, we mean that there was no chemotherapy received, there was no radiation received, but the treatment access was good. So the number of people here, they are over 5,000. So, and when you look here, there is no chemotherapy received, but they received surgery, and the treatment was good, but the number of count is this. So it shows that effectiveness here is not good. Then when you look at this, so the treatment here was not so much of effective. But when you look at this, where there is the no chemo, but there is radiotherapy received, no surgery, the treatment was good, and the number is 3,000. So it's a yes, the treatment was received. So here, no, the treatment was never received. Then when you look at this, and where they received at least 3 of them of the treatments. That is they didn't receive chemo, but the rest they were good. You see that the percentage of them is higher, so there's treatment access. And when we go around here, where they received chemo, they received no radiotherapy, they received, but the treatment was also good, the account shows that there is a bit of low. And here, when you look at chemo, those that received chemo, if you can now see these two, where there is surgery and chemo, they exhibit the highest they exhibit the highest rate of the treatment effectiveness, that the treatment really works. That someone who receives the chemo and also receives the surgery but no radiotherapy and has good treatment, that means these patients can easily survive. As you can see, that their effectiveness of treatment is really good. And then here, where you see that there is chemo and radiotherapy but no surgeries, it is good, but a surgery is more of, I think, more effective. When you look at this, where they're all the three, that treatment was good. So you see these numbers, they a bit of range, it shows it's a yes. So that is it. That is how I came up with this. So the survival rate, we're looking at the deceased and survived. So we had the column having status, the survival status, which is deceased and survived. And then we had the row of patient count. So here we look at deceased but with limited treatment, then those that deceased with good treatment. So you see the numbers, of course they are low. Then there are those that survived with limited treatment, they're even higher than those that deceased with good treatment. And then those that survived with good treatment, they are the highest. Recurrences and time to recur. We are here looking at the female and male, and we're looking at the recurrences. Those that recur, no or yes. Those that do not recur, or those that recur. So here I looked at the average time to recur, time for recurrences, and I had explained that, how I came up with that, and where I had to get the average sum of the calculated field divided by the number, then the count of the patients. So to get this average time to recover, this is it here. So when you look at this, you're able to see that number of female and recurrence, which is no, but they were 29. Then you see the male, almost they are not the same, but almost the same. They look a bit the same, but they're not. And then when you see that those that recurrences and the time when they recur, you look at the average is around 29 and 60. So they're almost looking the same, but they are actually not the same. They are slightly above the other. Lastly, we're going to look at the dashboard. So this is a dashboard, and I came up with this dashboard to show a brief of all the different graphs and histograms and the different shapes that we've come up with. So we have used the stack bars, we used the side-by-side bars, I used the pie chart, and I used the horizontal bar graph. So these are the different shapes that we have. I have as of now, including the KPIs, which are in small size but they're visible. So we have explained everything here. I think I don't have to explain a lot. it looks like this. Yeah, it looks like this. Where we had to put I had to put the cancer, the title. You go to dashboard, you create a dashboard, you give it a name, and then when you come here, you're able um, to drag and drop different graphs and charts to the dashboard. So when you see the survival analysis, the patient demographic, the treatment, the patient, the recurrences, the cancer stages, all these that I've been explaining, it's how it came about. I beg to submit, and thank you very much for listening to me. I'm available for any other questions. Thank you very much.